facial nerve in the temporal bone. The facial nerve is closely associated with the vestibulocochlear nerve as it enters the internal acoustic meatus of the temporal bone. Traveling through the temporal bone, its path and several of its branches are directly related to the internal and middle ears. The facial nerve enters the internal acoustic meatus in the petrous part of the temporal bone. The vestibulocochlear nerve and the labyrinthine artery accompany it. At the distal end of the internal acoustic meatus, the facial nerve enters the facial canal and continues laterally between the internal and middle ears. At this point the facial nerve enlarges and bends posteriorly and laterally. The enlargement is the sensory geniculate ganglion. As the facial canal continues, the facial nerve turns sharply downward, and running in an almost vertical direction, it exits the skull through the stylomastoid foramen. Branches. Greater petrosal nerve. At the geniculate ganglion, the facial nerve gives off the greater petrosal nerve. This is the first branch of the facial nerve. The greater petrosal nerve leaves the geniculate ganglion, travels anteromedially through the temporal bone, and emerges through the hiatus for the greater petrosal nerve on the anterior surface of the petrous part of the temporal bone. The greater petrosal nerve carries preganglionic parasympathetic fibers to the pterygopalatine ganglion. Continuing beyond the bend, the position of the facial nerve is indicated on the medial wall of the middle ear by a bulge. Nerve to stapedius and chorda tympani. Near the beginning of its vertical descent, the facial nerve gives off a small branch, the nerve to the stapedius, which innervates the stapedius muscle, and just before it exits the skull the facial nerve gives off the chorda tympani nerve. The chorda tympani does not immediately exit the temporal bone, but ascends to enter the middle ear through its posterior wall, passing near the upper aspect of the tympanic membrane between the malleus and incus. It then exits the middle ear through a canal leading to the petrotympanic fissure and exits the skull through this fissure to join the lingual nerve in the infratemporal fossa.